IBS. Millions of people suffer with it, but few people know what the underlying causes are and how to fix it naturally, drug free. Do you feel uncomfortable and bloated, especially after a meal? Well, maybe you've rushed to the bathroom with cramping and stomach pain and wonder what's wrong. Well, you're not alone. Millions of people experience these digestive symptoms, and for many, the underlying problem is something called IBS, Irritable Bowel Syndrome, also known as irritable gut. I'm Dr. Krystosik, and today I want to walk you through the symptoms of IBS, why it happens, and most importantly, what you can do to manage it safely to heal it naturally. You see, IBS is a functional digestive disorder. What that means is it causes pain, bloating, and diarrhea and constipation. But most of the time, when doctors run conventional medicine tests like endoscopies or colonoscopies or blood tests, well, everything looks normal when it comes back. But you see, there's no visible damage or structural damage that occurs with conditions like Crohn's disease or ulcerative colitis. Still, the symptoms are very real and can interfere with daily life in a really big way. Well, the tricky part is the symptoms of IBS aren't the same for everyone. For some people, it shows up as chronic constipation. For others, well, it's diarrhea. And many go back and forth between the two. It's very unpredictable and it's frustrating, and it can be embarrassing as well. But understanding the root cause can give a roadmap for healing. So, what does IBS actually feel like? Well, the symptoms can vary, but there are some really common patterns. The most frequent are abdominal pain, cramping, and often relieved after a bowel movement. And many patients also complain about constant bloating and excessive gas and a heavy feeling, uncomfortable feeling, even after eating a small meal. Well, some people with IBS experience diarrhea right after eating, while others struggle with hard and infrequent bowel movements called constipation. There's also something called mixed IBS. And here's the problem with that: people swing between diarrhea and constipation. On top of all this, there's anxiety that comes with it. You see, you never know when the symptoms are going to hit, and which can make social situations and work meetings really stressful. But what actually causes IBS? Well, the answer isn't one single thing. It's a combination of underlying causes. One of the biggest problems is the disruption in the gut brain connection. Well, you may have heard about this. It's a term called gut brain axis. This is the communication channel between your gut and your brain. And then stress and anxiety and emotional health can have a direct effect on your gut and for people, especially with IBS. This connection can become overly sensitive and really disrupt the gut. Another major cause of IBS is food sensitivities and hidden or delayed food allergies. Foods like gluten and dairy and high fat meals. In fact, any food can trigger IBS symptoms. When your digestive system struggles to break down these foods, it can lead to gas, bloating, and cramping and pain. And then we have the gut microbiome, the trillions of bacteria living inside your intestines. When the balance of good and bad bacteria is imbalanced and it's disrupted, it's a condition we call dysbiosis. Your gut's going to suffer. Unhealthy microbiome has been linked directly to IBS symptoms. And some people with IBS also have issues with low stomach acid, or they aren't producing enough digestive enzymes, which means their food is not getting broken down before it reaches the intestines. This can cause irritation, inflammation, and more bloating, gas, and cramping. Well, see, lifestyle also plays a role. Lack of sleep and a sedentary lifestyle, well, in other words, getting out and exercising very often is not something you commonly do, and a diet loaded with processed food, especially refined carbohydrates and sugar and bad fats, it all makes the gut much more sensitive. Medications and past gut infections can set the stage for IBS as well. Now, let's talk about the solution because the good news is there's a lot that you can do on your own to calm the gut, restore the balance without having to rely on medications. And I'm going to share several natural solutions for IBS with you right now. One of the most powerful things you can do is changing the food that's on your plate, changing your diet. And within 1 or 2 weeks, many of my patients who suffer with IBS see big improvements or their symptoms completely vanish. And this doesn't mean you need to avoid all healthy foods. It just means you need to temporarily cut out certain foods that are hard to digest and are common allergy offenders. The good news is you can then reintroduce them slowly back into your diet to see which one triggers your symptoms and which ones are going to make you feel good. Foods like dairy and eggs and gluten and sugar and refined carbohydrates, well, they're common culprits that cause IBS. And while fiber is important for gut health, if you increase it too quickly, it can actually make the symptoms worse. So the key is to go slowly and focus on soluble fibers from foods like oats and chia seeds and cooked vegetables. Another natural remedy is probiotics from fermented foods. These are foods that have bacteria that can help rebalance your gut microbiome. Fermented foods like sauerkraut and kimchi and miso and kombucha and kefir are good sources of these foods. Sometimes a high quality probiotic supplement like Saccharomyces boulardii is really going to be a benefit as well, especially if you've had antibiotics in the past and your doctors overprescribed them. Along with probiotics, digestive enzymes can help, especially after meals if you have bloating. These help to break down the proteins, fats, and carbohydrates more efficiently, which can reduce bloating and discomfort. We also can't forget about the role of stress. Remember the gut brain axis that I talked about just a little while ago? Well, stress management is just as important as diet. Even simple daily practices like deep breathing and meditation or prayer, or just taking a short walk or outside can significantly reduce the flare ups of IBS. And lifestyle changes go hand in hand with these strategies. Getting adequate sleep, like 7 to 8 hours of sleep, and going to sleep at the same time every single day, and drinking plenty of water and doing mindful habits that are often overlooked but can play a huge role in healing the gut, like eating slowly and chewing your food thoroughly, and avoid eating late at night. They're going to all give your digestive system really a lot of complications. But if you follow the principles that I'm talking about, it's going to support your gut and help you feel a lot better. For fast temporary relief, you can find this in remedies like peppermint oil. If you take peppermint oil capsules, they've been shown in research studies to calm intestinal spasms and reduce pain. Herbal teas like ginger and chamomile or fennel can soothe the digestive tract and ease gas and bloating. These simple solutions work for most people, but there are times when you should see a doctor that prescribes natural medicine. Like if you notice blood in your stool or unexplained weight loss, or if you have like persistent fever or severe abdominal pain, it's important to get checked out right away. These could be signs of something more serious than IBS, like inflammatory bowel disease or appendicitis or even colon cancer. That's why functional medicine testing can be so valuable. Instead of just masking the symptoms with medications, I routinely test my patients with IBS for food sensitivities. Most allergists test for immediate food allergies. Those usually occur within the first half hour, up to an hour maybe. Well, in this case, I'm talking about these delayed food allergies. The offending food doesn't cause a reaction until maybe 3 hours up to 3 to 5 days after you eat the offending food. The bottom line is you want to identify these foods, and I routinely do a blood test for over 180 foods to detect these hidden food allergies. And these hidden food allergies are a very common problem. Another thing is imbalance in bacteria in the gut microbiome, as well as parasites, and are the other hidden causes of IBS. You see, I order a comprehensive stool test for many of my patients with gut health problems. And with that information we get from the comprehensive stool test, we create a personalized healing plan tailored for each person because no two people are alike. Well, So to wrap this up, IBS may not show up on standard lab tests or scans. These are the things your family doctor usually run, but it's still very real. And you may not be able to have any relief from your doctor because their hands are kind of up in the air and they don't know what to do. But the good news, it's not something you have to suffer with forever. By getting the right tests and the personalizing the person's diet and being able to rebalance your gut microbiome, that's the bacteria in your gut, and supporting the gut with digestive enzymes and managing stress and eating fermented foods. These things you can really make a huge difference with IBS, especially if you change your lifestyle habits. You can take control of your gut health again and cure IBS within a matter of just weeks. Well, I'm Dr. Krystosik, and I can tell you, I've seen so many of my patients transform their lives by taking these steps. If you found this video helpful, my friend, make sure to like it and subscribe to my channel for more natural health advice. And be sure to share it with someone who struggles with gut health problems. And if you'd like to get some personalized help, take advantage of my limited time only $79 20-minute consultation, which normally costs $125. The link for the consultation is in the description. And if I can help you on your journey to better health, well, then I'll let you know. And if I can't, I'll refer you to somebody who I think can help you. Until next time, ciao for now.